far, so good. No intruding on your sound, is it? Good, how are you? I'm Morris from Herald. How's it going? Harry, nice to meet you. No, I don't think so. Are you based at Parliament? And that's Martin. Yeah. You're saying what you're doing. I am. Probably a couple of days. Well, that's job. Yeah. That I'm doing. Solid. You guys.
But then would they?
I guess, yeah, at least.
Yeah.
It's unfortunate.
That's in this room. I assume it would be Auckland. Doing flights.
Yeah.
Well, it sounds like they wouldn't have direct flights coming to Auckland. Sorry. Yeah, that's right. Straight out of the late 90s. Maybe earlier. You will share it, like, you will share about 3 or 4 laptops, so.
Yeah, well, I'm one of the few who has one.
Oh, really?
But yeah,
All right,
we
stories
can
in
come from stuff, but
yeah, all right, stories in 7.
yeah, we've got 2 cars.
Really?
Yeah.
Just 2? That's actually not that many.
Yeah.
Yeah. Your
There've
Uber
been
bill
several.
must be high.
One last bit.
No, that's Uber. Local providers. Yeah.
Next is,
Have to keep it
Redeem.
What about Zoom? Can you Zoom in or not?
Yeah, which side would you like to be on? Your left. On my left, so if you sit across. Good.
Kia ora koutou katoa. Thank you very much again for coming to the media briefing and for your flexibility around the timing. Once again, I'd appreciate it if you could include the sign language interpreter in the picture. I'll just give you as much of an update as I can on the assisted departure from Wuhan and the Air New Zealand flight that's currently on its way to Wuhan via Hong Kong, as I think you know. The aircraft has landed in Hong Kong. You'll be aware that the crew that is going to now take that aircraft from Hong Kong to Wuhan and through to Auckland has already been in Hong Kong for several days resting ahead of the journey. So they have been giving a landing slot by Chinese officials to arrive in Wuhan this evening New Zealand time, and we're expecting the flight to land in Auckland sometime tomorrow afternoon. Officials are in the process still of finalising the passenger numbers and the balance of how many New Zealanders, Australians and other foreign nationals will be on that flight. The latest information I have is that there were 263 people registered to travel. The majority of those are New Zealand citizens or permanent residents. There are also a number of Australian citizens and also some foreign nationals, predominantly from Pacific Island countries. The experience of other countries who have undertaken similar flights is that the number who end up on the flight is not really known until the flight takes off. Some people experience difficulties travelling to the airport. There is also the process of exit screening by the Chinese authorities. And then, of course, as you know, we have our own health assessment before people can board the flight. So we won't know the final numbers nor the balance of those on the flight in terms of their nationality until the flight leaves. We're aware the flight will arrive at the Auckland terminal at a dedicated gate, and we expect once the passengers have all been processed through the usual customs and biosecurity clearances, there will be a further health assessment, and then they will be bused to Whangaparoa, to the military camp there, where you're aware they are going to be housed and looked after for the next 14 days, or for the 14 days after they arrive. There is a range of measures in place to ensure that those who are involved in processing the people returning, of course at the Chinese end, then looking after them in flight, then at this end, and then who are caring for them over the subsequent 2 weeks are protected. And we can also reassure the local community that there is no risk to them of the fact that these people will be in Whangaparoa military camp. There will be security measures in place to, first of all, ensure those people are safe, and of course to protect their privacy. And I'm sure I can count on the media and New Zealanders to just protect these people who are largely Kiwis. They've returned home under pretty stressful circumstances, and they're wanting to get on with their lives as much as possible and make things as normal as possible, particularly if they have children. They will, of course, where possible, be able to work remotely. We're looking at the educational needs of the children there, and we will be looking after them. They will have a health assessment each day to check on them, and there will be a health liaison person on site 24/7. So just to reiterate that the border advice, the advice from the Ministry of Foreign Affairs and Trade is that New Zealanders don't travel to any part of mainland China at this point in time, and that stands, as do our current border measures. And you'll be aware that as part of putting those measures in place, there was an undertaking to review them every 48 hours, and we have provided some advice through to ministers on just how we might do that assessment, and there'll be further information around that to come out. Just in terms of the latest information on the New Zealand picture, I'm pleased to confirm there are no suspected cases and no confirmed cases. There are 3 tests currently with ESR that are just being done, as we've done a number of tests over recent days, just as an extra precaution where people have had symptoms that could be novel coronavirus, but they haven't necessarily fitted the suspected case definition. I wanted to hand over now to Dr. Caroline McElnay, our Director of Public Health, just to briefly cover some of the arrangements that would happen or actions that would happen if or when we do get our first case in New Zealand. This information is all on the Ministry website. There's a very detailed piece of advice for primary health professionals and other clinicians. She's just going to talk briefly about the sort of what happens when we get a suspected case, and then if it's confirmed, what the contact tracing arrangements are. And I should say then we'll have about 5 minutes for questions. I have a flight to get to, so I will need to leave promptly. Thank you very much.
Thank you. So the details of our approach to this are on our website in our guidelines for health professionals. Contact tracing is a standard part of work that our public health units do all the time. Now that coronavirus is a notifiable disease, any suspected case of coronavirus would be notified to the local public health unit, and testing would be done to confirm whether or not that is a confirmed case of coronavirus. And then the public health unit goes through a very standard approach of identifying where that case has been and any possible close contacts who might have been exposed to the case whilst the case was infectious. And then there's a process of contacting those close contacts and providing advice, which is predominantly about isolating themselves at home, staying away from social gatherings, and to emphasise what the symptoms are of coronavirus infection, and then to report any symptoms as soon as possible by phone to their health provider. And that information is then monitored by the public health unit. It usually does involve a public health nurse being in touch with those contacts on a daily basis to check their symptoms and their progress.
Thank you, Caroline. And I'm happy to open up to any questions now.
Are you taking any supplies over to China like food?
No, that's not the focus of the mission over there. It's to bring back the New Zealanders and other foreign nationals on the flight.
Who has the ultimate say as to whether or not passengers are well enough to travel?
So the passengers will be assessed by a St John's doctor with the support of 2 St John paramedics, and it's also an Air New Zealand doctor, so it will be their final assessment to determine if people are fit to travel.
How are the teams feeling about getting over to Wuhan?
I don't have any sense of that, and what I hope is that when they arrive back that someone will be available to just give a sense of how the journey went and what it involved.
How long does the detection test that you've developed take to, from start to finish to produce results?
So the process is about 24 hours, and the reason for that is the actual running of the test is a few hours, but the samples have to be collected, transported to the ESR laboratory, and then because they can only use the machine it's taken up then for that period of time, they batch all the samples and just run it once a day. So it's usually about a 24-hour turnaround.
Has anyone in Wuhan already been denied entry onto the flight?
I don't have any information about that.
You said yesterday 6 people have been tested for coronavirus. Have there been any others in the last 24 hours?
What I can say is there are 3 tests currently with ESR, and none of those previously tested have tested positive.
You spoke a little bit about the security measures for them when they come back, but can you just speak a little bit more about how the health staff and crew will be protected?
Sure. So anyone who's involved with processing the people coming back from Wuhan will be advised around precautions, but the basic precautions are they will have masks and gloves, and again the fundamental thing is good hand hygiene, as we've been reiterating, but that is the most appropriate precautionary measures, and that's what anyone who's involved, particularly those who are involved in being in close contact with those people for a short period.
Have you had anyone about their self-isolation request?
Well, we don't have any information on that, but our experience is that, especially in a situation like this where there's a high level of awareness and concern in the community, that people are very good at self-isolating, and we've got very clear advice on our website about just what that entails.
If you identify that someone isn't self-isolating and requested, what is done?
So, again, mostly in these situations, a conversation is all that's required, some advice, and generally it's also seeing what support people need to comply with the self-isolation expectation. If necessary, the medical officer of health does have powers, but in our experience it's very, very rare that those have to be used.
When New Zealanders return from mainland China, but not Wuhan or Hubei province, they're supposed to self-isolate, is that
Yes.
correct? And if they arrive in the airport, do they then go get their bags and take a taxi home and then self-isolate? Or how does that work to get them securely to their homes?
Well, no change in the arrangements. People will be going home, remembering that they will have come through. If they're on those flights now, they are being met by health staff. They are being given direct information and quite clear information, including about how to self-isolate and what precautions they need to take to reduce risk to others in all situations, including during transport.
Yeah. Is there anything being done for people who strong sort of social or family support networks to give them food or supplies if they need to be in their homes for 14 days?
That's one of the things we are looking at, is actually whether there are ways we could check on people and make sure they've got the support they needed, and we're just developing up some options for that.
Do you have a register or a list of the people who should be currently self-isolating?
So there is information collected at the border of those people coming back from China, of course by border agencies, and that's part of our look at options for how we might be able to provide support for those people, just to check in and make sure that they've got everything they need.
Does that include people who've come via Australia or another country?
Yes, so remembering that it's anyone coming in who might have been in China, mainland China, on their way back to New Zealand, even if they've transited through another country. All those people are being met, and you'll be aware that Customs is now manually processing everybody through, so the smart gates aren't operating, so they can collect those details.
What about the people who came through, say, last week before the ban was in place? Are you tracking them as well?
Last week, up until Monday this week, the expectation around self-isolation was just for people who had been in Wuhan or Hubei province, and that is still very much the epicentre of this outbreak, as you will know from the number of cases. So our advice stands for those people. People who may have been in other parts of China prior to Monday this week are not at the same level of risk, and so they don't need to self-isolate.
The Australians who have come back, are coming back with the New Zealanders, are they going to be sent to Whangaparo as well, or are they going to be sent on to Australia?
We're still working on arrangements for them with Australia, and that's still an open question.
Has anybody been turned around at the border who've come from overseas, any foreigners at this point?
I don't have that information, but I'm happy to get an update and provide you with information at the next stand-up. Perhaps one more question.
Just going on, just touching on the passengers again, how will they be monitored for signs of illness, and by who?
On the flight?
Yes.
Yes, so there will be medical staff on the flight and the St John paramedics, and they will be able to indicate if they've got any symptoms, and those staff also will be checking up and down the plane during the flight. It's quite a long flight, just to make sure people are well. And of course, remembering that people may get symptoms of other illnesses, and people sometimes get unwell during flights for a whole range of reasons, particularly if they have a pre-existing medical condition. So I think it's very reassuring to know there are actually a couple of doctors on that flight.
And what will happen to the plane after it lands? Does it need to go through any sort of quarantine?
So you'd have to ask Air New Zealand specifically on that. My understanding, and they've already made a statement on this, is they've got a very thorough deep cleaning process they will be putting that aircraft through, and it's one they do anyway when they have someone who's been ill on a flight.
Just all New Zealanders who remain in mainland China but can't reach the Wuhan flight for travel restrictions and such, what is your message to them?
Well, my message to them is that they should just keep very aware of what the situation is and follow the same sensible precautions around self-isolation and care, and in particular those basic hand hygiene and cough and sneeze etiquette protocols. So there's a lot of very good information out there. Look, I'll have to leave it there, but thank you very much and appreciate your ongoing support.